afternoon, Miss Amal. Today I would like to ask you some questions regarding your nursing skills and characteristics as a leader and as a nurse manager in our unit in C3. So for the first question, I would just like to ask, as a nurse manager, what are your motivations as an administrator? Like, what motivates you for your overall work?
Um, you are talking about motivation, okay? It's really something really large to answer, yani, as an example. But usually we are trying to balance between clinical care and administrative and ensure the staff satisfaction. So this it need really to be quite difficult to balance between all these things. Uh, Usually our target is patient safety, so we need to have a good environment in all aspects, from staff, skills, knowledge, and in the same time you need to support and motivate them in a well organized environment.
Thank you for that answer. And I would like to ask only, what leadership qualities do you have or do you apply as a leader?
Uh, Usually you have to be good listener, to listen to your staff, um, sound some clinical knowledge. You have to have fair manner management in your, plus you have to have a good communication with all staff and the level of organization in your department.
I see. So thank you for that. I understood from what you've said that communication is very important,
Very important.
effective communication. And how about your critical thinking and decision making skills? Can you impart some knowledge on how you deal with it?
You know, for critical,
Yeah, critical thinking and decision making skills. Like if any crisis that will arise or how you make decisions for the
usually
unit.
from your experience, through the experience, since I moved to many areas like oncology, neuroscience, so your experience, it have a role. Your you know, the learning, and it's non-stop, so I have to involve myself also in many leadership courses as annual, as basic, um, plus the communication again with my open communication with other uh, leaders, colleague, even the staff, the frontline staff, to understand all the situation. Then that time you can take your decision upon the situation or according to the situation or the incidents itself, which it's really affects your staff, your patient safety, so that the time you can decide. But all in all, it depends on your experience, uh, your knowledge, how you develop yourself. So to have that background to solve your issue.
So as they say, experience is the best teacher, right?
But it need to keep on learning every day, and to use all the resources to support your experience.
Yeah, I
Yeah.
agree. And for the next questions, how are you able to handle conflicts in the workplace in case it will arise? How do you manage it?
First of all, you have to understand the whole picture from all aspects, to listen for everybody, uh, the one involved in that issue. then you have to take your time to decide what to do. It's not just unless it's really urgent, so you have to take the action in 1 second. Otherwise, you have to take your time, listen for all, call all them together to discuss, uh, because you know the miscommunication, misunderstand, it's involved, especially I can say in this hospital we are from different culture, different background, so the communication, it's really a big part there, which sometimes it makes a barrier to understand each other.
So effective communication again.
Effective
is the
communication
key.
again.
Yeah. And how about if you have any financial and entrepreneurial skills that you are applying as a nurse manager? Like how do you, if in case there is any finances that deals, like,
If you are talking about finance, you are talking about hiring or courses, support, or whatever. If two parts, uh, usually all finance it with administration, but at least we have to prepare ourselves as leaders, our staffing, census, so we keep to report if we have shortage of staff. With supplies, equipment, again we have to prepare and put earlier plan.
so for the next question, how about your, how you utilize technology in decision making process?
Technology,
Like use of the
yes.
email?
Actually in our hospital we are also used as official communication of the emails, and everybody is responsible to answer or receive their email because this is the official communication. Our system for nursing is also, we can say it's technology advanced regarding vital signs or some, and we are toward paperless. Inshallah, I hope it will be soon of all these documents. So we are going for technology. Yes, it's help. Okay, to communicate people, easy to reach them. Okay, so it's help in some way the technology in
Yeah.
nursing field.
We also have WhatsApp sa in the
Yeah,
unit.
WhatsApp, but it's not,
Not the
an
official.
official.
Yeah.
For that, I did not mention it's not official way.
Email.
Okay.
And BlackBerry.
BlackBerry, yes, we have telephone. Even our glucometer, it's
Yeah,
advanced,
for
connecting direct to the lab.
Lab.
Okay, and for the database of the patient direct in the computer. We are in process for that.
so it's very
Okay.
helpful, right?
Yes,
for
it's
that.
really help.
And how do you involve yourself in policy making?
Um, Actually, as a leader, we have to be part of the policy making, from initiate policy, especially for nursing, or to be in a committee for revise policy and develop policy. So I'm a member in the committees, which it's really also requirement from all leaders to involve in this policy, this policy inequality department, nursing equality department, and some committees related for all policy and procedures. As leader, also we have part also with nursing education department for develop and update all our clinical practice up to date. So to be also reflected in our policy. So we have almost, you can say, a big role in.
So for the question, for my final question, it's a personal question. I would just like to ask, is it hard to become a leader?
Honestly, I can say yes, because you are the center, okay, where you are responsible and accountable for patients, staff, physician in your area, because it will be all conflicts around. Plus, you have a pressure from the administration for applying all policy and procedure and to put everything in place. So as you are the one be in the front line to face all these people, um, but with help of each other, to work as a team, to have a support, you feel you are okay, fine, you can manage. Sometimes you take breathe, okay, I will do it, I'll make it, and it will be fine. Thank you.
Thank you so much, Ma'am
Thank you.
Amal. And I hope I will learn a lot from your answers.
Thank you.
Thank you.